Welcome back. Since the pandemic began, almost 10,000 children have turned to Pathstone Mental Health for services. That's a 35% increase over the previous year. CEO Shaun Baylis joins us now. Shaun, the effect of the pandemic on these kids won't just go away when things return to normal.
It's going to have a prolonged effect because it's been a prolonged period of time since they've been going through this the social isolation, the feeling of not belonging, not feeling connected. So consequently, we're going to see these numbers continue to sustain itself for, I think, for at least another year.
How do you handle this volume, this increased volume? A 35% increase in anything is really, really problematic.
We were doing extremely well before pre-pandemic, where we ended up having no wait times in any of our programs. Because of the cumulative effect over this past year, we now have a few programs, particularly one which is our brief counseling. It's way over the top with regards to the numbers. We have about 200 waiting at this stage, which we haven't had in the past 3 years because of the influx of the number of referrals that have come through.
You've had a huge increase in the demand for kids in the 6 to 10 age group, which is very, very concerning.
Yes, and it's basically because of the not being in a structured environment like school that their anxiety has increased and feeling disconnected. They're not as connected to the virtual aspect of with their friends and social media as children who are older, and therefore it's really had a compound effect on them that they're reaching out to parents to be able to help them with those kids at this particular time.
You really bring up a great point there because with kids of all ages, you can't just paint all of these problems with one brush. There's different problems at different age groups.
Yeah, and I think too is like the eating disorders be more of the adolescent group that's coming in. Like I say, the numbers have skyrocketed in that particular area, that it's lent itself to where we're actually having to focus more on that aspect. We have a great team here where we've been able to do some juggling with regards to people focusing on brief therapy that may have been doing some other work in the long-term aspect to help us out. And we've got some we will be looking at how we can generate money that we have in our bank account from the foundation to help support brief therapy as well, to help deal with this huge influx of the referrals that have come in.
Let's talk a little bit about your team. How stressed out is your team with this higher volume? And what about your team's mental health as well?
Well, it's been an ongoing concern, particularly with counselors, because we also experience secondary trauma. That when you're talking to people about issues that also impacts our own lives, that lends itself to what we do call the secondary trauma, which creates a heavier feeling on a counselor and more draining. Our counselors are experts here and they do extremely well and they've done a good job of being balanced, but we have been putting in programs and education sessions and ideas of how to modify their work so that they can cope more effectively with the challenges that they have to face with, because a lot of them have kids and they're doing homeschooling while they're still doing counseling virtually from home. So we have a staff that's just excelled in that area to be very open and very nimble and very receptive to trying different ways of being able to help kids in the community.
There's also the cloud of the problem with funding. You mentioned the foundation, and so many fundraising efforts are much more difficult now. So is there that hanging over you as well? How do you maintain the funding for these services that you're offering?
Yeah, our foundation director, Kim Rossi, has been very creative and has been able to reach out. And I've always found Niagara residents have always been sympathetic to mental health issues with children specifically. And so on an individual level, those donations have gone up. On a corporate level, because of the challenges they've had, they haven't been able to provide as much as they have in the past. So the numbers are down lower, but it's healthy compared to what it is. And we're taking that money specifically to help support our efforts.
Do you think getting kids back in school in the month of June will help to solve some of the anxiety and loneliness problems?
Well, as a matter of fact, the lead agency consortium is made up of 33 lead agencies in each region, like Pathstone is for Niagara. We all have come together and have supported that they need to return back to school for the purpose of being able to get socialized. It's not just us, it's CHEO, there's McMaster, there's in Ottawa. They're all talking about that part of the importance of them connecting through the school process, of course, with all the safety measures in place, but they need to get back to school in that way, and that this lockdown is going to, if it continues, is going to have huge challenges in the future.
This will mean a demand for more funds in the future for Pathstone as well, will it not?
There'll be the demands for it, but of course, we've been very fortunate that our ministries, they've been very helpful through COVID as well in terms of being able to provide COVID money to help support these programs. In the future, we don't know what's going to happen in that particular area, but the government is aware of the seriousness of mental health, and even look at the adult side of the overdosing, and the suicide rate is going up. So consequently, they're very aware and very clear that they need to have that as a focus.